Thank you very much. Hey, do you ever notice your dog's eyes tearing sometimes? Well, Dr. Jerome Williams is here and Dr. Beth Gibbons is here today to talk about that and what that is and how you can do something about it. Hey, doctor, it's good to see
Hi.
you.
Good to see you.
Who do you have here?
This is Minnie Healy.
So Minnie apparently has that issue.
She did.
She did?
Yes, about 3 months ago we
Okay.
fixed it for
So
her.
what's going on when that happens?
Well, there's lots of different causes for it. It can be an infectious cause. It can be
So cute.
it can be irritation, and in her case, she had extra eyelashes that were growing down and rubbing on her cornea.
Oh.
It also can be from the tears not being able to drain properly, and so in her case, her eyelid rolled in just a little bit on the corner of her eye and the inside corner of her eye, and it crimped the little duct that drains the tears. And so her tears weren't able to drain through her nasolacrimal duct properly, so we just were able to remove a teeny tiny bit of skin, and we were able to fix that problem
How
for her.
common is that?
It's fairly common. I see it a good bit, and so you know, sometimes we can figure out what exactly the problem is and get it corrected for these guys, and get the problem solved for them.
So Dr. Williams, do you see this and can you tell when something like that's going on?
We do see it, but unfortunately for many of us veterinarians, we're not skilled enough like our ophthalmologists to know what to do. So when we see this, then we'd be wise to refer to an ophthalmologist like Dr. Gibbons that can fix it. Many times we just, treat it empirically without success.
So I think she's grateful to you. She seems to like you very much. As we're looking it out, what are we seeing here that we're looking at?
I think that's
the
the after. That's the after
Okay.
picture, and so you can see that she's
I couldn't
not,
tell a problem. Yeah.
Yeah, we did send in a before.
I don't know if we have that. Suzanne, do we have the before? Okay. Yeah, we weren't looking at it. Sorry. You may have had it on the screen, but we weren't. So
There's the before,
Okay.
so you can see the tearing there.
The brown stains around the eye indicate excessive tearing. The tear should go in the tear ducts and come down and drain inside the nose.
Okay.
But if not, then you get that stain outside. If it's a white dog, then it's much more obvious.
right, and if it goes untreated, what happens?
Well, in the case of dystichia, that's where we have the abnormal eyelashes. That can actually lead to other problems like persistent corneal ulcers, which can be
Goodness.
painful. So it's a good
Goodness.
idea to get it checked out.
We had to take care of you then. So if you see, and if you do see the stains like that, is it always that, or is,
No, there's many different causes
Okay.
for it, and sometimes it's something that we need to correct, and other times it's not quite as pathologic. So
okay.
yeah.
But getting to the bottom of the cause is one of the things that, again, we as veterinarians got to
Right.
tell our clients and show them that it's something that can be corrected. It's something that can be treated.
All right, so those little marks, that warning sign that we need to have them looked at, like when we have warning signs for stuff, right?
Right.
All right, well, very good. Well, you sure are a cutie.
It's so good to
very
have Dr.
cute.
Gibbons with us. She can be reached at the clinic on Acton Road.
On Acton Road. All right, very good. Well, you sure are pretty. Thank
you.
you.
Thanks
Dr.
for having
Gibbons,
us.
thank you. Dr. Williams, always
Okay.
good to
Thank
see
you.
you.